Hello, Abbotswood. Thank you for joining me for this month's Health Talk. This month we will be talking about hydration and how that affects us. I am Mike. I'm the Rehab Director for Legacy here at Abbotswood. I'm also one of the physical therapists. Every month we do one of these health talks, again, to kind of promote health and well-being throughout the community. Like we said, this month we will be talking about hydration. It's an extremely important topic with our summer months coming up and it getting a little bit hotter. We see a lot more dehydration episodes, so again, it's a very important topic to discuss at this time, but important to think about throughout the year. So first we're going to talk about why it's so important to make sure your body stays hydrated. First, we need to talk about dehydration and what dehydration is. Dehydration is a condition that develops when the body loses more water than it takes in, so fairly simple. Our bodies can lose water because of a variety of different reasons. Okay, one of them is general illness, can cause water loss, medications, an inability to move, or difficulty moving around, a diminished sense of thirst, and compromised kidney function can all lead to reasons we are losing more water than we are taking in. Dehydration is a very common condition and affects many persons over the age of 65. If left untreated, severe dehydration can develop and result in serious illness. It can even be life-threatening. In fact, dehydration is ranked one of the top 10 most frequent reasons people on Medicare are hospitalized. But the good news is dehydration is fairly easily avoided. Okay. First, we're going to look at some common causes of dehydration. And one of the biggest one is our body's loss of water because of medications. Okay. Medications frequently prescribed for seniors often result in increased risk for dehydration. Many prescription drugs that treat heart disease, regulate blood pressure, and moderate kidney and liver diseases are called diuretics. Those diuretics are meant to promote the formation of urine by the kidneys. Often seniors are not even aware that they're taking these types of medication and these diuretics. So they're unaware that they may be more affected by these medications and need to be compensating a little bit more by trying to drink a little bit more water. Living alone can also increase one's risk for dehydration for a variety of reasons. They say community-dwelling seniors often do not drink enough fluids to maintain their health. One reason for this is muscle weakness. Okay, decreased strength can make it a little more difficult for people to get around, making it much more difficult to get into the kitchen and get themselves a drink of water. Another reason seniors often don't drink enough water is incontinence. Okay, incontinence is very prevalent, and it can discourage people from drinking water because they feel like if they stop drinking water, they'll have less incontinence episodes, which actually isn't usually the case. So again, it's one of those things, and we'll talk a little bit more about it as we go, that decreasing your fluid intake can actually increase those incontinence episodes. But again, we'll talk about it a little bit later. Another reason they don't drink enough water is diminished sensation. Okay, and so as a person ages, it gets more difficult for them to perceive thirst, and again, that could be a reason why they are not drinking as much water as they feel like they need to. So as you can see, there are a number of risk factors that contribute to dehydration among seniors, but again, there are things, some very simple things we can do to make sure that this does not happen. Okay. So let's just go over some common signs of dehydration. So again, that we know when we start to see these things, we're getting on the verge of getting into that area of being dehydrated. Some very common ones that kind of come up. The number one thing is feeling thirsty. Okay, and so again, they say if you're feeling thirsty, make sure we are going ahead and drinking plenty of water, because at that point we're probably already on the verge of being dehydrated. We may notice that our urine is a little bit darker. We are not going to the bathroom very often. We have frequent UTIs. And then again, we can also experience dizziness, weakness, dry mouth, and dry skin. Those are all going to be signs of dehydration. Okay. Like we talked about before, usually the first sign is thirst. If a person isn't drinking enough fluids, then his or her urine will start to turn dark in color. We have to be careful about the color of the urine. Some medications can change the color of our urine, so that may not be the perfect telltale sign that things are changing. So we do want to be careful when it comes to that one. But again, if we're not taking that many medications and you're noticing a big change in the color of your urine, dehydration could be a part of that. Decreased urine output contributes to the risk of urinary tract infections or UTIs. UTIs typically develop when a person fails to drink enough water and toxins are not properly flushed out of the body. As a result, bacteria can build up in the bladder, resulting in a UTI. So just being dehydrated can contribute to more UTIs. So if you are experiencing a bunch of UTIs and can't really figure out the reason, then we want to make sure we are drinking plenty of water throughout the day to kind of flush that bacteria out. Again, if we're having issues with incontinence, people can get a little self-conscious. They stop drinking the water, then they're getting more UTIs, they're having more incontinence episodes, and we kind of keep on this spiral track downhill. So again, it can all kind of be mitigated by just drinking a little bit more water. Other signs of dehydration include chronic fatigue, muscle cramps, weakness, confusion, headaches, dizziness, dry mouth, a drop in blood pressure, more rapid heart rates, and irregular body temperatures. Okay, so those are some ones that you may not think of right off the top of your head, but always good to know the signs and symptoms of these of this issue, so that when we do notice those things, we can do something about it before it gets to the point where we have to go to the hospital. So now that we know that dehydration is a serious problem among seniors, and we know the first signs to watch out for, let's discuss how dehydration can be prevented. First, it's really important to know your body's need for water. And so that's going to be different for everybody, okay? That depends on a lot of different factors. That depends on your size. That depends on the amount you're getting around. There are a lot of different factors that contribute to how much water you actually need throughout the day. But a really good rule of thumb that I think still stands right now is 8 glasses of 8 ounce glasses 8 times a day. Okay. Again, it's not perfect for everybody, and we may have to adjust that a little bit, but I think it's a really easy thing to remember. And again, a good rule of thumb to kind of start with. Don't wait until you're thirsty to take a next drink of water, because by the time you start to feel thirsty, we're probably already verging into being dehydrated. There are some other issues. I know even in this building, people have issues with sodium levels in their body, and so they are actually limited in the amount of water they can drink. So again, just be aware of those things for yourself. Talk to your doctor before you start anything and make sure it's okay with them that you are getting a certain amount of water a day. If we are limited to a certain number, make sure we are hitting that number every day. So again, we don't increase our risk of becoming dehydrated and having something bad happening. Next, be sure to talk to your doctor about any medications you're taking and find out if dehydration is a common side effect. If you don't know if you're taking a diuretic, make sure you find out, again, talking to your doctor. And just knowing that fact, again, can help you kind of mitigate how much water I need to be drinking and those types of things. Also, when you're taking that diuretic, you're going to the bathroom more often. So people, again, feel like if they decrease their fluid intake, they won't have to go to the bathroom as often. That's just simply not the case. You probably will end up going as much, but then you'll just become dehydrated very quickly because you're not replenishing those fluids. And again, that's when we have to end up going out to the hospital and those types of things. If you're suffering from muscle weakness and you're finding that it's difficult to get around, get into your kitchen to get that water, there's some different things we can do. Make sure you have like a large water bottle that you can fill up once or twice a day instead of having to go multiple times to the kitchen. Obviously, here at Abbotswood, we have nurse care who come in very frequently. A lot of people just have safety checks where they pop in. That can be a time where somebody else could help you get a glass of water and those types of things. So just try to always make it very accessible to you. Again, if you are having issues with muscle weakness and getting around, come talk to me. Obviously, that's something we work on very heavily, and we can figure out what the easiest ways, what the best ways for you to start to get up and get around a little bit more easily. If you are fearful of drinking water because you are experiencing those incontinence issues, our occupational therapists in this building work they have a lot of experience working with incontinence and continence management. There are some exercises that you can do to try to reduce the episodes of incontinence. So again, come talk to me about it, and we'll figure out what the best plan for you is, and we'll try to get that going. Just always remember, limiting your fluid intake can actually make incontinence worse because it puts you at a higher risk for UTIs. And then again, we just kind of keep going in that spiral. And again, nothing ends up getting solved, but we always want to make sure we're drinking plenty of water. Last, be sure to eat plenty of fruits and vegetables, okay? These foods contain large amounts of water and vitamins that help keep your body hydrated. So again, not just fluid intake, but actually looking at your diet a little bit can help stay hydrated and avoid dehydration. So that's another great point to make when we're talking about this. So we've covered a lot today. We looked at how dehydration is a serious problem among persons 65 and older. We talked about different causes and risk factors for dehydration, as well as the signs and symptoms to watch out for. We then talked about things to prevent dehydration and ensure your body gets the fluid it requires to maximize your well-being. There are several ways, again, therapists and doctors can assist you in preventing dehydration. So please stop by our office. We're up on A wing, about halfway down. If you see me in the hallway, flag me down. Our phone number is 919-848-2233. Feel free to give me a call. Again, if you just go up to the front desk and let them know, I'd be happy to stop by your room and talk about any of these things that you had questions about. Remember, 8-ounce glasses a day is a good starting point. We always need to check with our doctors before we do anything because, again, there may be some restrictions to that. But again, that is a great place to start and a really easy thing to remember. So again, if you have any questions, please do not hesitate to give me a call. Thank you so much for joining me for this month's Health Talk. I'm always open to suggestions, so if you guys have any topics that you would like me to talk about, please let me know. And I hope to see you next time. Have a great day.